Instilling spinal hygiene habits in childhood can prevent future spinal problems like disc degeneration, scoliosis, or chronic pain as they age. Stay tuned because today we'll discover how spinal hygiene impacts postural development, growth and flexibility, better physical performance, and a healthy nervous system. Hi there, I'm Dr. Krista, founder of the American Posture Institute, and your host for Peds Week Online, the Pediatrics Virtual Summit for Healthcare Professionals. It's an honor to introduce our next guest presenter. Dr. Tabor Smith is a trailblazer in the subject of spinal hygiene and holds many events and lectures on the subject. Dr. Smith received an honorary alumni award from Life University in 2020. He's the creator and facilitator of Life University's Certified Spinal Hygienist program and the executive producer of a documentary titled A Better Way. He's a self-proclaimed student for life and continues to advocate for advancements in the fields of chiropractic, spinal hygiene, and overall natural health. For information on his documentary and helpful education tools, you can go to abetterwayfilm.com. And for more information about the spinal hygiene program hosted at Life University, it can be found at spinalhygienist.com. Today, he'll be sharing with us pediatric spinal hygiene. Dr. Tabor, thank you so much for joining us today as a speaker for Peds Week Online. Please take it away.
Thank you so much. It is an honor to be here. Like Dr. Krista said, I'm Dr. Tabor Smith, and this is my 18th year of being a chiropractor, and I've dedicated those years not only to sharing the message of chiropractic, but really in the specific area of spinal hygiene and the prevention of degenerative disc disease. And preventing degenerative disc disease starts in pediatrics. It really does. If we started in pediatrics as a culture, as a society, we could limit a lot of the conditions, a lot of the diseases, a lot of the issues that people are experiencing at very high rates today. In fact, it's all about the nervous system. Taking care of the spine ensures that we have a healthy nervous system. And if you're a chiropractor or really any practitioner, you've heard it said that the nervous system is the master controlling system of the body. Even in Gray's Anatomy, the textbook states the nervous system controls and coordinates all organs and structures of the human body. It even controls the things we do not think about, like heart rate, blood vessels, gland activity, and all other organs. Now, I was sitting in a lecture one time, and a very educated doctor stood up, and after this was stated by the speaker, he said, I don't really believe that. He said, all the organs have their own nervous system. The heart can beat by itself if you take it out of the body. And the speaker, he looked at him and he said, yes, if you take the heart away from the body, it can beat on its own. But if that body starts running, the heart cannot adapt to the energy requirement or the environment to keep that body sustained and keep it alive. And this is what the nervous system really does, is it's a feedback mechanism that creates homeostasis in the body. It creates balance in the body. So how healthy your nervous system determines how well your body is going to be able to adapt to the environment. It's going to be able to heal, and it's going to be able to function. This is an area of health that is missing when it comes to our society, and absolutely not there almost at all when it comes to pediatrics. And so that's why we want to help to implement this in offices, especially chiropractic offices, but even other practitioners can be aware of their pediatric clients and patients and how healthy their spine and nervous system. And I believe we can make a big impact on these types of statistics. In our society today, more than 70% of adults across the US have already been diagnosed with a chronic disease. And we know that chronic diseases don't start yesterday. They take years to grow and to even turn into symptomatic problems. Now, speaking specifically to children, the Children's Health Defense states that 54% of American children are suffering from at least one chronic health condition. And pain is affecting more Americans than ever before. It affects more Americans than diabetes, heart disease, and cancer combined. So pain, being in pain, and specifically even spinal pain, is a very big issue in our country. It's the number one reason, being in pain is the number one reason Americans access the healthcare system period. And it's the leading cause of disability. And it's what leads to over 130 people a day overdosing from type of drug called opioids. And this happens every single day. It continues to happen, and it just doesn't get the publicity that it used to get. So we have a huge mission in front of us. It starts with pediatrics. It starts with teaching families how to take care of their spine and nervous system, because degenerative disc disease, or the breakdown of the spine, in my opinion, is the most devastating and mostly silent. We're going to talk about that today, but also quickly growing problem to face the human race. Back in 1994, the CDC stated that they expect osteoarthritis, or we could even call that type of degenerative disc disease, right? They expected osteoarthritis to double before 2020. They actually missed that prediction because it more than doubled by 2020. So then they came out with another statement, and they said by 2040 that they estimate 78 million, or 26% of US adults aged 18 years or older, are projected to have doctor diagnosed arthritis. That means they have pain, symptomatic, took them to the doctor diagnosed them with arthritis. Think about this. They're predicting this in 2040, that people of 18 years and older are projected to have doctor diagnosed arthritis. That means they're predicting that your child or your children in your office will have arthritis at that point. And so it's now that we need to be able to step in and do something to help them prevent this degenerative condition, or at least limit the risk factors as we're moving forward, which we're going to talk about what the risk factors are. Even the Cleveland Clinic says that it can take a long time for cartilage in your affected joints to wear down enough to cause pain and stiffness. So these studies here actually reiterate that degenerative disc disease is a silent condition that can start and be there for years before you actually feel it. In this study here, they took 3,110 asymptomatic individuals, so individuals who did not have pain, and they put them through an MRI. They showed that the prevalence of disc degeneration in asymptomatic individuals was increased from 37%, 37% of 20-year-olds. So again, that arthritis or degeneration has been there for years, even during someone who was a teenager or before, all the way up to 96% of 80-year-old individuals. So almost everyone by the age of 80 had degenerative disc disease. Another asymptomatic study where they looked at spines showed that 85% of the population show evidence of disc degeneration. And again, quoting them here, it says the vast majority of these cases are asymptomatic. They're asymptomatic until they're not asymptomatic, right? And then what about specifically, children? We don't really look for degenerative disc in children very often, but in this study this was Scottish researchers, and they took MRI scans of the lumbar discs of 154 asymptomatic 10-year-olds, and they said, we found degenerative changes in the spine much earlier than we would have ever suspected. They found that 9% of those children had the beginning stages of degenerative disc disease. And they even said in this study, really, is it surprising because of kids being in poor postures and sedentary and all of the lifestyle factors that we live in today? And this is actually a screen capture from the CDC's website showing that this was their prediction. And you can see that degenerative disc disease, along with other arthritises, are growing in our population. So we're going to talk about the causes so that we can then talk about prevention. But there's a reason why these numbers are growing over time, and more people are being diagnosed with degenerative disc disease. In 2015, again, these numbers are taken right from the CDC, 15 million adults reported severe joint pain due to arthritis. So it does eventually cause symptoms. Just to put this into perspective, 15 million adults, we only see as a chiropractic profession, we only see about 35 million people, and this is not regularly. This is just people who have been to the chiropractor. And so this is half the population of our clients who suffer with pain due to arthritis. In fact, the national costs of arthritis alone in America are $304 billion. Again, to put that into perspective, the entire industry of chiropractic is only a $19.5 billion industry. So we would have to grow 15 times the size right now of our profession just to take care of the problematic, symptomatic patients that are suffering from arthritis. So if you're looking for a way to grow your practice, you're looking for a need in your community, here is one right here, is to start educating and sharing these concepts of maintaining the health of the spine, lowering risk factors, and preventing as much as possible this process of decay that happens into the spine. So why is spinal degeneration getting worse? Why is the CDC showing this graph where, since the 90s, we're seeing more and more and more decay and degeneration in younger and younger ages? Well, it's because of poor postures. So, technology, being stuck in front of a cell phone. Kids are on iPads at 2, 3 years old now. They're in these degenerative postures all day, not to mention sedentary lifestyles that are, we're moving a lot less than we used to. And there's study after study after study that show a link between poor posture, sedentary lifestyles, and increased rates of spinal degeneration and decay, specifically because you're putting stress directly on the spinal joints. And we know from Wolff's Law that stress on a joint causes it to remodel, which then will cause it to form calcifications, bone spurs, and eventually break down into osteoarthritis. And then look at this. This is again, copy-pasted quote from the CDC. It says the Center for Disease Control Prevention reports that children ages 8 to 10 spend an average of 6 hours per day in front of a screen. Kids ages 11 to 14 spend an average of 9 hours per day in front of a screen. And youth ages 15 to 18 spend an average of 7.5 hours per day in front of a screen. No wonder we're starting to see degeneration and decay. And if you're a chiropractor who takes x-rays in your office, I've spoke with, we speak to audiences of chiropractors. I poll the audience almost every time I speak, and everyone raises their hand and they say that they're seeing more and more degeneration and decay on x-rays at younger ages than they've ever seen before. Most doctors report degeneration happening at C5, C6, that middle part of the neck, because we're always in this head forward shift, this head forward posture. In fact, you can see it right here in the posture of these children, and again, they're on this technology for hours a day. Don't get me wrong, I don't think we can do away with technology. We need it. We're using technology right now. It can be very beneficial. But in just a second, I'll show you why I believe we need interventions in order to prevent this, because of this concept of this new introduction of technology that we didn't have even just decades ago. In fact, this study right here showing the effects of smartphone usage or viewing duration on body position, on head and neck posture in elementary school children. They took 34 children. They took postural images and pictures of them. They had two groups, and these groups were utilizing smartphones for different hours per day, greater than 4 hours per day, less than 4 hours per day. They showed that there was a significant increase in head flexion, neck flexion, and gaze angles and it made long-term postural effects in these kids after more than 4 hours of smartphone usage. And so this is what's causing this misalignment in the neck. We see it a lot, again, as chiropractors on x-rays. We call it a reversed curve. It used to be called military neck. Now people are calling it tech neck. And this subluxation or this misalignment in the neck is causing increased rates of decay and degeneration. And we're starting to see it in pediatrics as well. So this brings up a big question that we want to answer. Is there anything that we can do to combat the degenerative effects on the spine that we're seeing? If there is, then as healthcare practitioners, specifically chiropractors or practitioners who are dedicated to the health of the spine, it's our job to educate and help our patients and clients and community to be able to implement these strategies to be able to prevent this degeneration. And so I want to take you back to an earlier time and a different profession that saw a very similar thing happen, and that's dentistry. In fact, we didn't always brush our teeth, we didn't always floss, and then there were times in our society where tooth decay or at least changes in our dental plaques happened. And so here's a study right here. Sequencing ancient calcified dental plaques shows changes in oral microbiota with dietary shifts of the Neolithic and Industrial revolutions. And basically what this says is there's only two times in our history where you can go back and you can dig up these bones and you can look at the teeth and you can see there are two times where we specifically can tell there was a change in the teeth due to a change in our diet. And basically, what that means is there's a change in the body due to a change in our environment. So here it is. Two of the greatest dietary shifts in human evolution involved the adaptation of carbohydrate-rich Neolithic farming diets beginning about 10,000 years ago. So basically, 10,000 years ago, we went from just hunters and gatherers to farmers. And when we did that, it increased the carbohydrate in our diets that we ate, carbohydrates or those sugars. Even back then, it wasn't that bad, but it did change our teeth. We started to get a little bit more cavities. And we can see this when you find these fossils that you can tell whether these people were hunters and gatherers or were they farmers because of the change in their teeth. The only other time in human history where it actually made those changes was in the early 1900s, the late 1800s, early 1900s, when industrialization came in and processed flours and sugars became in effect. In fact, before that, the average American ate maybe 1 pound to 2 pounds of sugar per year, and that would be all the vegetables and fruits and everything. Today, the average American eats 152 pounds of sugar per year. So not only in our health, that certainly affects our weight and our health, but what does it do to our teeth? It increases the amount of cavities. So post 1900, post industrial revolution, we can see that cavities or tooth decay started to become more problematic. And that is exactly when dentistry stepped it up to the next level. That was when Dr. Alfred Fones, who we now call the father of dental hygiene, he turned his niece into the first dental hygienist, and they started teaching people to take care of their teeth because they were seeing that teeth were decaying at younger ages. Even in the pediatric populations that they had so many cavities, they were pulling so many teeth. They said, we got to step in, we got to do something. So what I will argue here, and the reason I bring this up, my point is that I believe a very similar phenomenon is happening in our spinal health today because of this introduction of technology. Just like in dentistry, they introduced a model for dental hygiene. You need a brush, you need a floss, and you need to go to a dentist regularly to prevent tooth decay. In today's society, we have so much technology and we're in such poor postures all the time that the spine's degenerating at faster rates. And we need to create a model to be able to help people to prevent spinal degeneration, just like dentistry has created that model to help them prevent tooth decay. So, for example, in dentistry, here was the problem. We see that excess sugar in our diet causes bacteria, which bacteria in our teeth will digest those sugars, secrete an acid, and cause tooth decay. All right. So then dentistry said, here's the solution. There's two solutions. You could either eliminate all the sugar from somebody's diet, or you can implement dental hygiene and dental strategies to prevent it, maybe even a little bit of both, right? Because they realized that we're not going to be able to eliminate all the sugar from everybody's diet. Just it's our culture, right? Now, in chiropractic, we have a similar issue because we're seeing excess screen times, poor posture, long-term sitting, sedentary lifestyles, and this culture is causing spines to degenerate at faster rates because it's causing misalignments, it's causing abnormal biomechanics, or what we call subluxations throughout the spine. So there are really only two solutions. Number one, we could eliminate all screens, all technology, and get everybody up and moving, which I think that's a great idea, but I also think that's probably not going to happen in our culture because we need this technology. The other option is to implement spinal hygiene strategies and visits to the chiropractor where we're looking and we're checking these postures and the health of the spine. And you know what? Maybe even a little bit of both might be a good strategy, just like dentists recommend as well. And I believe we can see results. So what we did with the spinal hygiene movement is we wanted to create a model that we can present to the world, just like dentistry created a model. And so what we want in our model to be able to preserve the health of the spine, starting even in pediatrics, is we want to be able to have a practitioner that owns spinal health, just like dentistry owns dental health. And that would be chiropractic in my recommendation, because this is what, this is what we focus our whole career on, is alignment, mobility, strength of the spine. And so you want to have a chiropractor on your health team, or you want to teach your patients that they should have a chiropractor on their health team, so that they can have someone to go to for expertise. And then their responsibility for them, what they need to be doing at home is they need to be aware of their posture and alignment. They need to be aware of the muscle tone and strength that they have, their core muscles, and they need to be aware of their flexibility and mobility. Those are things that they can do at home, just like brushing your teeth and flossing are things that dental patients can do at home. So this term called spinal hygiene, when we started using this term, there really wasn't a definition for this, and I don't believe there's still a definition in the medical dictionaries. So we came up with a definition. Spinal hygiene is the set of practices associated with preservation of the spine, including maintenance of spinal health, which involves both home spinal care and regular chiropractic checkups and adjustments. And we say that there are three foundational concepts of spinal hygiene. And by the way, for practitioners out there listening, this is great content to be able to share with your patients. You're always looking for social media posts, videos that you can create, emails, campaigns, blog posts. You can take so much from these concepts, and people really resonate and understand it. For one, the spine should be in a certain alignment. It's well known that the spine should be straight from the front. It should have natural curves from the side. This really isn't even debatable. You can look all the way back to Leonardo da Vinci. He was one of the first people to dissect cadavers and draw the spine. He drew it straight from the front, having natural curves from the side. So we want to help people to restore and maintain that alignment as best as possible. Number two, the spine should move through a full range of motion. And again, not debatable. Decreased range of motion is widely accepted as a negative finding across a lot of different professions. So we want to be able to help people maintain that mobility, maintain that flexibility, so that those joints can stay healthy. And the third foundation of spinal health or spinal hygiene is that those muscles around the spine and those core muscles should be strong, fit, and I would even add balanced in that. Postural and core muscles are a vital part of spinal health, and people can maintain that by doing some simple exercises at home. So we developed the core 4 spinal hygiene exercises that we believe everyone should be doing. Families should be doing this, sharing this with their children, teaching them how to maintain these 3 areas of their spine: alignment, motion, and strength. And I won't go into these specific exercises in detail. You can see them there. There's a range of motion stretch, resistance band to help fight head forward posture, wobble ball exercise to help increase imbibition and movement through those discs, spinal molding that we have patients lay on every night. Our website, as Dr. Krista mentioned, is spinalhygieneproducts.com or spinalhygienist.com, and you can find out a lot more information about that there. So why should, we should teach spinal hygiene exercises just like dentists teach dental hygiene for people to do at home, but why should they come regular to a chiropractor? Because just like with dentistry, you can prevent cavities by brushing and flossing. And so if our patients are doing spinal hygiene exercises, they might be able to prevent some subluxations by doing those spinal hygiene exercises. But once the cavity is there in the tooth, you can't brush your cavity out. You need an expert. You need a dentist on your health team to be able to go to. The dentist is trained to detect and correct that cavity, then help you and educate you on how you can maintain that the teeth at home, and you can just come in regularly for cleanings. Well, it's the same concept in our offices in chiropractic. Is once you have a subluxation, you can't exercise a subluxation out. You need a chiropractor on your health team to detect and correct those subluxations with a chiropractic adjustment. And then as a chiropractor, educate those patients on how they can prevent vertebral subluxation from happening in the future. So we see families all the time in our offices. These are pictures of us adjusting babies from, a couple of days old to even teenagers that come in with their families, or even sometimes we have parents that just bring their kids in as well. These are my kids doing their spinal hygiene exercises, and so we teach our patients, even our pediatric patients, how to do those exercises that we call the core four, how to lay on their spinal molding rolls. And if you go to spinalhygieneproducts.com, you'll see our spinal hygiene kits and all the different products that we recommend. We use in our office, and we give our patients for home use as well. So let me end with this. How will spinal hygiene help grow retention or help grow long-term growth in your office? I love sharing about spinal hygiene, and most of what comes out of me is the benefit to the patient, because I want every patient to be practicing spinal hygiene. I know it can benefit their health tremendously. And sometimes I kind of I lack a little bit telling the practitioner how actually educating your patients on spinal hygiene will help you and help your office. And retention is certainly one of the things that I've noticed in our offices and the offices that utilize these spinal hygiene concepts. Patients stay longer. They understand why they should be under care. A mentor of mine, Dr. Stephen Franson, he always says the key to patient retention is to convert believers into understanders. And what that means is when a patient comes into your office and they sign up for care, they believe you can help them, but they don't really understand how you can help them or why they need to be under care for a lifetime. So it's now our job to educate them as they go through their program and help them become understanders. So then when they get to the end of their program, they'll understand why they should keep coming and why they should be doing their spinal hygiene exercises for life. So just like in dentistry, the dentist's ideal patients are understanders. I have dentists that practice right next to me in our office building, and they have great retention. Every time I go in, they give me a toothbrush, they give me floss, they say, make sure you're doing this. They watch me floss to make sure I'm doing it right. Why? Because they know that if I care about the health of my teeth and I understand how to maintain my teeth, I'm going to be their lifetime patient. And you'll find this in your office as well. Your ideal patients will be the people who really understand these concepts. They care about the health of their spine. They want to know how they can maintain the health of their spine. And when you teach them that, they'll be there with you for a long time. So thank you for allowing me to share today. These are my emails, our website links. If you have any questions or need anything, I'm always here. It's been an honor. Thank you.
Dr. Tabor, thank you so much for your excellent presentation. We love your information on spinal hygiene, and more importantly, all the movement that you have created around this to educate the general consumers, your patients, and then other practitioners to then go out and educate their community. So thank you for the phenomenal work that you have put into this to make all of our lives easier as practitioners. I don't think there's anybody out there who couldn't agree completely with everything that you've just said and stated about the importance of spinal hygiene, especially starting for kids.
Absolutely. Thank you so much for letting me share that. It's certainly been a passion of mine, and it's fun to see the light bulb go off in people's minds when you present this, because it makes sense, and people like things that make sense. And when you share this, the number one reply you're going to get when you share this information with your patients is, "Why didn't somebody tell me this earlier? I can't believe I didn't know this."
Yes, no, it absolutely makes sense. And when we can have that communication, like you said, making them into understanders, now you've got those lifetime patients. I'm going to go through a quick summary and then a couple questions for you. So
Sure.
you talked about preventing spinal degeneration starts in pediatrics. So taking care of the spine is all about the nervous system, the master controlling center, controls and coordinates all structures, organs, and functions of the body, and then adaptation to the environment via feedback mechanisms for homeostasis, which really dictates our health, healing, and function. We've seen an epidemic of sick and suffering people. More than 70% of US adults have chronic diseases, 54% of children have one or more chronic illness. Pain is affecting more Americans than diabetes, heart disease, and cancer combined, and pain is a leading cause of disability, with 130 people per day overdosing from opioids. This is a serious problem and epidemic. Degenerative disc disease is a silent, quick-growing problem that's facing humans. By 2020, osteoarthritis more than doubled. By 2040, more than 26% of patients will have doctor-diagnosed arthritis, meaning that they already have pain and symptoms associated with it. So do something now for kids to reduce the risk factors. It takes a long time for the spine to wear down. It's a silent condition that starts years before patients start feeling it. You shared with us some really great studies. 96% of 80-year-olds have DJD. About 37% of 20-year-olds already have degenerative joint disease or degenerative disc disease. 85% of the population has DDD, and they're asymptomatic, meaning that it's still happening even if you're not feeling the symptoms yet. And it's a yet, right? The symptoms will likely come. And then
Right.
already 9% of 10-year-olds who are asymptomatic, and the research showed that this was much earlier than anticipated for degeneration. And the CDC prediction, degenerative disc disease and arthritis are growing and expected to keep growing over time. 15 million people reported severe joint pain due to arthritis. National costs are over $3 billion for arthritis. There's an absolute need to educate your community about spinal hygiene. So, why is spinal decay getting worse? Poor posture and sedentary lifestyle. Again, there's not a practitioner listening that doesn't completely agree with that statement. We're seeing the stress on the spine, increased rates of degeneration. Stress on a joint causes remodeling, bone spurs, and then osteoarthritis. With CDC showed that the children are spending between 6 and 9 hours per day based on age in front of a screen. X-rays are showing more degeneration on films than ever before, particularly right about C5, C6 level. And the solution is not to get rid of technology. I say this all the time too. I'm not anti-tech, but I'm pro health choice and pro intervention to have healthy bodies while engaging with technology. The study, you showed a great study where viewing duration of head and neck posture on smartphones showed a significant increase in head and neck flexion as well as gaze angles, leading to long-term postural effects for children after only about 4 hours. So, what can we do? Spinal hygiene and education. You gave a great parallel with the dental profession, showing changes in oral microbiota, which led to dental degeneration due to environmental diet changes. 10,000 years ago, we went from hunting and gathering to farming, which changed the teeth. And then again, the Industrial Revolution, introducing processed foods and sugars, and we started seeing more cavities and decay. The dentistry developed dental hygiene and similar phenomenon to spinal health due to technology. So now suddenly we're seeing a change in our societal shift, a change in our environment, leading to more degeneration and decay. And so the dentists are a great example of an effective public health campaign for spine, and we can do that for spines like teeth. So we can't eliminate technology. We don't want to eliminate technology, but we need to take care of spines. So the spinal hygiene model, which Dr. Tabor has created, is about posture and alignment, chiropractic, flexibility and mobility, muscle strength, balance, and core tone. And then spinal hygiene practices to preserve, so the definition, I didn't get it exactly, but more or less it's practices to preserve the spines, including maintenance of spinal health for at-home exercises and chiropractic checkups. And
Yeah.
spine should be in alignment, should be in full range of motion. The muscles supporting the spine should be strong, fit, and balanced. You shared with us the core four for alignment, motion, and strength, looking at range of motion, resistance bands, wobble ball, and spinal molding exercises to do daily. And then why regular chiropractic care? Just like dentistry, prevent cavities with spinal hygiene at home, but once a cavity is there, you need to go to the dentist to get it filled. So same with chiropractic, to detect and correct. And then growing with retention, thank you for mentioning this important point. Long-term results and practice growth with spinal hygiene. So patients stay longer and they understand why they're staying longer. The key to retention is to convert believers to understanders. And I think the dentists, through dental hygiene, have created understanders and lifetime patients as a great model that we can learn from. Dr. Tabor, again, I just want to thank you and acknowledge you for the phenomenal work that you continue to do. Quick question for you. If in an ideal world, if spinal hygiene took off to the absolute masses and every patient knew the importance of spinal hygiene and was coming in, what would be your recommendation for how often a child and then maybe into adulthood should come in for checkups? So for example, with dentists, they usually say every 6 months, come in for a teeth cleaning. In an ideal world, with everybody getting their spine checked, what would be that recommendation?
That's a great question. And my patients ask me this question quite a bit. And my answer is this is an area where the answer parallels with dentistry, but it's a little bit different, meaning that just the anatomical presentation of the teeth, they're outside of the body, technically. They're outside of the skin. So a dentist can literally scrape the plaque off the teeth. Whereas a chiropractor, we're working through inches of flesh, muscle, tissue, some very significant connective tissue that is and around holding those joints in or out of alignment. And so the frequency of visits is going to need to be greater to maintain that, which is why we've modeled our offices to allow people to get in and out quickly, because you have to come a little bit more frequently to the chiropractor than you do in dentistry. Typically, in across chiropractic, and maybe even more for convenience, chiropractors have recommended a once a month frequency for patients. And I think if everything is going great in the body, I think that's an okay frequency. Here's a little bit of my problem, and I personally recommend at least an every other week checkup and adjustment. And here's why. A lot of studies show that and if a joint is fixated or immobile for over a 2 week period, and one of the studies was done by Tapio Vitamin back in the 80s. He cast rabbits' legs and feet, and then he would cut into the joint at different intervals. So after a day, he would look at the joint under a microscope, and then after a week, and then after 2 weeks, and after a month, and 6 months, and 9 months. And what he showed was the longer that joint stays immobile or fixated, the more adhesions build up inside of the joint, and those adhesions turn into calcifications, which leads to degeneration of the joint. So to make my point is, if a joint is immobilized or fixated for more than 2 weeks, it starts to develop adhesions. And so I want to prevent that from my patients so that we can prevent degenerative disc disease, we can prevent arthritis in joints. And if I'm checking them every 2 weeks, finding those fixations and improving that mobility, I know for a fact I could make a big difference in the amount of arthritis or degeneration that their bodies produce, because I'm keeping those joints moving properly. So long answer short is, I would personally recommend in my offices every 2 weeks for patients to come in. We make it both easy and affordable for our patients to be able to do that.
Wonderful. Thank you so much. And as we wrap up another great session today for Peds Week Online, I'd like to acknowledge Dr. Tabor Smith for his excellent work in spinal hygiene. I'd also like to acknowledge you, the healthcare provider who's learning up-to-date clinical solutions to serve your pediatric patients at the highest level. I'm Dr. Krista, your host for Peds Week Online. Be sure to get the Pediatric Clinical Pearl Super Pack for ongoing summit access and tools for simple implementation into your practice. Stay tuned, and we'll see you on the next Pediatric Masterclass for Peds Week Online.